Hi, I'm Dr. Sheila Vidal. I offer ACT-based, trauma-informed guidance to help you better understand your mind and navigate stress with clarity and confidence. If you happen to be dealing with one of life's challenges right now, you're in the right place. Today, we're going to be talking about a question I hear often from people who are living with trauma, anxiety, or just generally feeling stuck in their own mind. What is acceptance and commitment therapy, also known as ACT, and how can it actually help me heal and move forward? What ACT is and how it helps. Here I'm providing a brief introduction to ACT, but there are plenty of fantastic resources online that offer detailed information about ACT theory and its history. Acceptance and commitment therapy, pronounced ACT, not ACT, is an evidence-based form of cognitive behavioral therapy that focuses on building something called psychological flexibility. ACT is considered a third wave CBT that has evolved from traditional CBT, shifting the focus from changing or altering one's thoughts and instead focusing on changing the relationship to one's thoughts and feelings. We do this by incorporating present moment awareness and acceptance of distress in order to build psychological flexibility. Psychological flexibility means being able to stay present with your thoughts and feelings, even when they're painful, and still choosing actions that move you toward the life you want to live. In my practice, I use the mantra, get up, dress up, show up, as best as you can today for what matters to you most. In ACT, the goal is not to eliminate every distressing thought, memory, or sensation. The goal is to help you respond differently to those experiences so they have less control over your choices, your behaviors, and ultimately your identity. When we bring ACT into trauma recovery, it helps you notice trauma memories, body sensations, or waves of shame or guilt without completely being pulled under. It helps us step back from old stories like I'm broken or I'm too much. Any unhelpful story that's become a pattern of thought for you. It helps you reconnect with your values, the things that matter most to you today. And it helps you take small, realistic steps toward a life that feels more aligned with who you want to be. I use ACT with adults in my practice, and I see how powerful it can be for people living with PTSD, complex trauma, anxiety, and long-standing unhelpful emotional and behavioral patterns. What is ACT in plain language? Let us break this down a little more. Acceptance and commitment therapy has 6 core processes, but for the sake of simplicity, we can group them into 3 main ideas. Making room for your internal world, that's your thoughts and your feelings, everything under the skin. Stepping back from unhelpful stories, not evaluating them as right or wrong, just noticing whether our life stories are serving us today. And moving toward what matters to us most today. First, making room for your internal world. Instead of spending all of your energy trying not to feel distress, not to remember, or not to think about certain things, ACT teaches you skills to gradually open up to your internal experience. That doesn't mean that you have to like it. Oftentimes we don't. But it means that we learn ways to breathe with it, to ground ourselves, and to allow it to be there without it ruling our behaviors or our entire day. Second, stepping back from unhelpful stories. Our minds are incredible storytellers, especially after trauma. You might notice things like, this was my fault, I can't trust anyone, or it'll always be this way. ACT gives you tools to unhook from these stories instead of treating them as absolute facts. We call this cognitive diffusion, which is basically a way of saying you learn to create space between you and your thoughts. After all, what is a thought anyway? It's nothing you can touch, taste, smell, or feel. But so often we allow our thoughts to dictate our moods and our behaviors every day. Third, moving toward what matters. ACT is deeply values-based. Rather than asking, how do I get rid of these symptoms? We ask, if your life were less controlled by these symptoms, what would you want it to be about? Maybe you value being a present parent, a caring friend, a creative person, or someone who stands up for others. ACT helps you identify those values and then take small, doable steps in that direction, even when your mind is noisy. One thing to notice here is that the distance between where you are now and where you want to be is often maintained by the way your mind relates to your thoughts and your feelings. If you feel stuck where you are, it's worth examining those thoughts and feelings that are keeping you there so that you can implement the skills that help you move toward the person you want to become. How ACT helps with trauma. If you've lived through a trauma, especially repeated or complex trauma, it's common to use strategies like emotional numbness, overworking, perfectionism, or avoidance just to get through the day. ACT doesn't shame those strategies. In fact, we often start by recognizing that your mind and your body did what they needed to do to survive. At the same time, we explore how those same strategies might be keeping you stuck today. With trauma, ACT can help you notice trauma triggers without automatically shutting down or exploding. Build skills that help you stay anchored in the present moment, even when the nervous system is activated. Relate differently to feelings like guilt or shame or self-blame. These feelings are common after trauma because the mind looks for an explanation or someone to blame. This turns down the distress. The hard part is that there's no simple way of making sense of trauma. Many of the factors that led to it were often beyond our control. However, we often remain stuck in a narrative of self-blame in order to have some explanation. As I mentioned in my previous video about the impacts of layoffs, our minds thrive on predictability. Predictability in our minds creates a sense of safety and security, while the unknown creates anxiety and tension. So even when the explanation of traumatic events is unhelpful and distorted, it does momentarily serve its purpose of reducing anxiety. However, in the long run, the impacts usually are not serving us. And ACT can help us re-engage with relationships, roles, and routines that matter most to us. For example, imagine you value being a present and patient parent, but when you feel overwhelmed, you impulsively snap or withdraw. In ACT, we wouldn't work on becoming the perfect parent. Instead, we would look at smaller ways to move you toward your value of being present, even if your nervous system is activated and your tolerance is low. That might mean practicing a brief grounding exercise before you walk through the front door, or learning how to name what's happening inside you without turning it into a story of failure, which just makes your distress tolerance even lower and perpetuates the old unhelpful pattern of responding. Over time, these micro shifts add up. Your trauma history doesn't disappear, but it becomes one part of your story rather than your whole identity and defining how you respond today. In ACT, we emphasize that you don't need to wait for the perfect conditions to engage in values-aligned behaviors. What's 5% you can do today? What's 25? Some days you might feel like giving it 100%. There's an ACT metaphor that says, jump out of an airplane and skydive or jump off a piece of paper. Just jump. What problems can ACT treat? ACT was originally developed to address a wide range of mental health concerns. It's been studied in over 1,000 randomized clinical trials. In my practice, I use ACT to support people who are dealing with trauma and PTSD, including complex trauma related to childhood or relational issues, anxiety and chronic worry, especially when the mind feels stuck in what if loops, depression and loss of motivation, where everything feels heavy and even pointless sometimes. Chronic pain or health conditions, where the body and emotions are tightly intertwined in an unhelpful story about pain. And identity and attachment challenges, where people are trying to untangle who they are from old and unhelpful family, cultural, or relational stories. You don't have to know your exact diagnosis for ACT to be helpful. If you have a sense that your inner world feels overwhelming or rigid or stuck, and you want a values-based way to move forward, ACT can often be a good fit. How ACT can change daily life. Sometimes ACT can sound theoretical, so let's make it more concrete. I want you to picture a few everyday moments. Moment 1, the spiral at night. You crawl into bed and your mind immediately starts replaying something painful. Maybe it's a conversation you had earlier, a childhood memory, or an image from a traumatic event. Before ACT, you might feel like you've had only two options: to keep spiraling or to try desperately not to think about it and to do something to avoid feeling altogether. With ACT skills, you might instead notice, my mind is replaying that thing again. Then you could bring your attention back to your breath, the present moment, or the feeling of your blanket, or the temperature of the air in the room. You might label the emotion and acknowledge, this is really hard right now, instead of, what's wrong with me, or why can't I stop this? And you might choose one small intentional action, like turning toward a guided grounding exercise or reminding yourself of tomorrow's values-based behaviors. Moment 2, the urge to avoid. You get an invitation or an opportunity that lines up perfectly with your values, but your mind quickly floods with reasons to say no. I won't fit in, I'll mess things up, or people will see the real me and I can't have that. With ACT, you practice noticing that the mind is predicting catastrophe, and you ask yourself a different question. What choice is more aligned with the person I want to be? You might say yes to a small part of the opportunity while also bringing your values and your grounding work with you. You tolerate distress knowing that it's temporary, which helps rewire your brain to acknowledge, I can do hard things, especially when they matter to me. Moment 3, the inner critic at work. You make a mistake or you receive feedback, and your inner critic launches into, you're so incompetent, you should have known better. Instead of arguing with that voice or believing it completely, ACT helps you see it as a learned pattern. You might thank your mind for trying to protect you, and then choose one concrete values-based step, like asking a follow-up question, making a repair if needed, or practicing some self-compassion, and then redirecting your focus to the next thing. Maybe these don't sound groundbreaking, but these are exactly the kind of moments where real recovery happens. ACT gives you more choice in those micro moments, which gradually shifts how you relate to yourself, to others, and especially to your own life story. I often tell people in my practice that ACT is subtle. We're not completing worksheets to change or challenge your thoughts. Instead, we're noticing that they're there, because what choice do we have? And we're dropping the rope in the tug of war with our minds, because we never win anyway. Our minds are relentless and they never, ever stop. Even when we're sleeping, our minds try to get our attention. We can focus on our behaviors, even small ones that are aligned with our values, and we can increase our tolerance for distress and pain, which are inevitable in life. Again, we don't need anyone's permission or the perfect conditions to engage in values-aligned behaviors. However, we do need to be very clear about what we value today at this phase in our lives. If you aren't sure what your values are, I invite you to complete a values exercise to help you clearly identify what matters to you most. I've inserted a link to a values card sword that I use in my practice. It has a list of 83 values and mini definitions. Choose your top 5 to 8 most important values. Not what you think should be most important to you, but what really matters to you and how you want to see yourself today. Please keep in mind that our values often change depending on the phase in our lives or what's going on in the moment. Perhaps health wasn't necessarily very important to you when you were younger, but you were recently diagnosed with an illness. So now health is very important to you, and you need to incorporate the behaviors that are aligned with health. ACT prioritizes our behaviors because that's where we can actually control things. We can't control our thoughts or feelings, which are fleeting and changeable. Is ACT right for you? You might be wondering whether ACT is the right fit for you right now. ACT may be a good match if you notice that your efforts to control or avoid your thoughts or feelings aren't working anymore. You've attempted therapy before, but the gains were short-lived and you still found yourself stuck in old, unhelpful patterns of behavior. You're open to mindfulness and values-based conversations, even if you're skeptical or hesitant. You want tools that you can carry with you outside of sessions and that take into account aspects of your specific lived experience. And you're willing to move in smaller steps rather than expecting a quick fix overnight. It is also completely okay to feel cautious. Many people have mixed experiences with therapy. In ACT, you can make space for that doubt and still move in the direction of the person you want to be. You don't have to be ready for everything all at once. This work focuses on building trust and helping your nervous system feel safer and letting your values guide the pace. If you're in crisis or needing immediate safety support, this kind of work is not a replacement for emergency services. Please reach out to your local crisis line, hospital, or emergency services if you feel like you're at risk or harm. If you want a deeper explanation of everything we talked about today, including more examples of the core ACT processes and how they show up in daily life, I've written a full detailed article on this topic. You can find it on my website under the blog titled Acceptance and Commitment Therapy, How It Can Help You Heal. In that article, I walk through each of the ACT processes in more depth and talk more about how ACT supports trauma and PTSD recovery. It also includes reflections that might help you pace your own healing with more clarity and confidence. If you're listening to this and thinking, this sounds exactly like what I've been looking for, but I feel nervous, that's a very human reaction. You don't have to have everything figured out before reaching out for support. If you live in California or Virginia and you want to learn more about working together using ACT for trauma, anxiety, or any related concern, you can visit my website at nextmissionrecovery.com to read more about my approach. And if it feels right, you can contact me for a consultation. Thank you for spending this time with me. If this video supported you today, I hope you'll check back in for more ACT-led, trauma-informed psychoeducation with me, Dr. Sheila Vidal of Next Mission Recovery Psychology. I'll talk with you in the next video.